So, good evening, ma'am. I'm Akriti, and welcome to the Solh Talk.
Thank you so much.
Okay. So, we have Dr. Bhavna Gupta with us. Ma'am is MBBS, MD, Pediatrics with Al Qasmi Women and Children Hospital at Sharjah, UAE, and adjunct clinical faculty at University of Sharjah. Dr. Bhavna has more than 14 years of experience in various hospitals of UAE and India at the pediatrician department. So, ma'am, we welcome you on a Solh Talk on World Health Day, ma'am.
Thank you so much.
So, as you know, ma'am, that on this World Health Day, there has been the theme of this World Health Day is our planet and our body, our mind. So, ma'am, it is very important to take care of our mental health apart from our physical health. So, ma'am, the topic that we had chosen for you was prevailing healthy minds among children, as you are specialized and you have your expertise working with the students, with the children. So, ma'am, according to you, how will you define the statement prevailing healthy minds among children?
So, according to me, it is a state of social and emotional well-being of a child, wherein a child is able to realize his full capabilities, his potentials, and he is able to learn and take responsibility of his own health and well-being. And at the same time, he is able to contribute to the society. And, they are the future of this world. They are the ones who are going to lead this world. So it is very important that we take care of their mental health and well-being.
Thank you, ma'am. And ma'am, so we generally see that it is like when every time we go to a doctor, we usually go for a physical health checkup, and we tend to ignore the mental health checkup. Though we know that there is that we have stress or we have anger problems or behavioral problems, we tend to ignore our mental health. So, ma'am, how important is it to take care of our mental health and why?
So just as physical fitness is important to keep our body healthy, similarly, mental fitness is important to take care of our mental health. There are many diseases which are associated with mental health. For example, if the person has high blood pressure or he has got diabetes, stress is associated with these diseases. So if a person is able to get a balance wherein they're able to reduce their stress, it will have a positive impact in controlling these diseases. And we have seen during this COVID pandemic that, we faced a lot of unprecedented things, and we had to face the unknown. So during these times, it was found that a lot of mental health issues like depression, anxiety, they had increased manyfold all over the world. And during these times, we switched our practices to taking care of our mental well-being, and we become stronger and resilient and mindful. So we cannot just ignore our mental health over physical health. They both go hand in hand.
Absolutely, ma'am. Well said, ma'am. So, ma'am, as we all know that, you are specialized and you have your expertise working with children with all aspects of problem, be it with their physical health or their developmental issues, behavioral issues. So, ma'am, how often do you see that a parent has walked into your clinic or has come up to you saying that my child is going through some mental health struggle or probably having some behavioral issues? So do you see it like very common parents walking up to you and asking you or taking your advice on mental health issues, or they just simply come and you see the child has a symptom, but you try to, convey this message to a parent, but they tend to ignore it. So how do you, what are your experience? What is your experience, ma'am?
Yes, so mental health problems, they have a stigma attached to them in our society. So people, they shy away from taking help, even if they're able to see it. they shy away from taking help because they have a fear of shame in the society.
Right, ma'am.
So, as you said, that parents, they might be knowing the problem or they might not be knowing the problem, but usually they are not able to discuss with the healthcare provider. And it has happened many times that we have identified those problems on our own when we are seeing the children in the clinic.
Right, ma'am.
But what is important is that we create awareness among people that this mental health disorders are very common in children, and they impact a lot on the growth of
Right.
the child. And when they grow as adults also, then only, people will take care of these issues also and take the help at the right time.
True, true, absolutely true, ma'am. So, ma'am, what are the common behavioral issues or the probably mental health issues you have come across in a child?
Okay, so they can have all kind of problems. They can go through depression. They can go through anxiety. They have behavioral disorders. Okay, and
Yes, ma'am.
as they grow up, when they are in this group of teenagers, at that time they are exposed to the media. They have a lot of peer pressure. So you can see many eating disorders in them. Okay, and they
Okay.
have aggressive behavior. So we call them,
Absolutely.
they all come under the umbrella of behavioral disorders. So these issues are common, but as we said, that people are not coming to a physician or a healthcare provider to address these issues.
Okay, ma'am. And ma'am, how do you deal with such issues? Like, how do you try telling a child that maybe you are having or you're going through such disorder or maybe some issues, and how does a child take that? Do they accept it, or probably they are very reluctant and they just want to go away, and then they're like, there is nothing wrong with me. So how do you actually convey those messages to a parent or to a child?
Yeah. So, children, they are mini adults, you can say that. Okay. They are able to understand everything. Okay.
True.
So if we say that, if we will discuss these issues with them, they will not understand. That's not correct, actually. So, if you find out that this child is going through this, I have seen many children, they come up and talk on their own. If they have
Okay.
some issues, they will come up and they will tell them that I am going through this. And
Okay.
when you point out to them that, yeah, this could be this problem, but in an age appropriate way, you have to explain them, definitely. But if you are
Absolutely.
able to explain to them and get them into your confidence, they will understand that. And I feel that children are more strong, they're stronger as compared to the adults, and they're able to take things into their stride if they are well supported.
Absolutely, ma'am.
Yeah.
So it is like, this is very uncommon to see a child is coming up and then speaking to you about his or her problem. I
Yes.
mean, it is very good that the child is having an insight that, I'm going through this and I want
Children
to
are
share.
very smart these days. They're very smart and they have a lot of exposure of media. And
Right.
so they come to know what's happening with them and they come up with their problems. If
So
they
this
feel that, if they feel that, that environment is safe, the adult is right to talk to, they will definitely come up with their problems.
well said, ma'am. Well said.
Yeah.
Ma'am, we know that a child has to go through a lot of psychosocial problem. Once the child is hitting adolescence or puberty, or there are various bodily changes or behavioral changes, hormonal changes that a child comes across. So, ma'am, do they have a profound effect on the development, functioning, and then a long-term mental health issues on the child?
Yes. So, when the experiences which a child has during their growing period is the building block or the architecture of their brain.
Right.
So if any disruption is there during this development process, so definitely it affects their functioning as adults. And it has been found that in many researches that many of the adults who have psychological problems, they originate from their childhood. So it's very important that we address the childhood psychosocial problems and support them so that, something which can be treated early, it doesn't become a disorder. So, yeah, so identifying them and taking the right support at the right time. We have a lot of health professionals now like psychologists, psychotherapists, behavioral therapists. So they're accessible now. So
Right.
it's a matter of awareness. If we are able to create that awareness, give them a platform wherein they can come up and talk about their problems, then we make an impact.
Absolutely. Well said, ma'am. So, ma'am, we have seen that, there are, like, as you just said, that there are various mental health professionals that are being available for for anyone to come in and seek help. But we have seen that, especially with a school counselor or a counselor or a psychologist who is at the school, the child is, I think, probably very reluctant to go and seek help, or probably you just said that there are some kids who just come up to you and they tell you that I have some issues and I want to speak to you. But then there are some adolescents and some children who probably does not come up and ask, or they do not tell you, or they do not tell any professionals that I'm going through this, or this is the problem that I'm facing at home. So, ma'am, what is the reason that they do not come speak to you, or they do not seek any professional help?
Yeah, for this is what we have to create a social and emotional well-being among children, so that they are able to come up with their problems. They are able to talk to an adult. As
Right,
you
ma'am.
said, school counselor. So if the school counselor is approachable, the child feels safe. They feel not discriminated, and if
Right.
person is non-judgmental, then definitely the children, they will come up and they will talk about it. And it's not they're after all children.
True.
So we have to build a rapport with them. We have to ensure that we give them the right kind of environment where they can talk in, or where they are comfortable. Then only it is possible.
Absolutely true, ma'am. Very well said. So, ma'am, we know that you actually also work with students or with this children who are actually gifted, or there's a special child. So, ma'am, how is it working with them?
So, special needs children, we must remember they are also children, but they are differently abled. So, every child is unique. We should remember that. And, their capabilities are different from what another child will have, but we cannot undermine it. We have to, we should know that they can function as well as other children, but they need a lot of support. They may not need little support which will give to other children, but these children will need more support from our side. And even in schools, when they go to school, we need to have special educators, special teachers who are able to blend the curriculum according to their needs,
Right.
rather than going through the same curriculum which other children will attempt. But when it is said that if a child goes in a school with the other children, they are being challenged. They feel
Right.
that the other child is able to do, so then I can also do. So they need to have that kind of challenging environment, and a lot of support. So if we are able to support them, they are able to function well also.
Right, right, ma'am. I think we should actually have an awareness system in a, an awareness, I think an environment in our ecosystem, because with these kids, I think they feel very left out when they come out in the society and they try to mingle up with the
Yes.
other children of the
Yes.
same age group.
So, yeah, as you said, people should be aware that, okay, they are suffering from some kind of disability, but that doesn't mean that they cannot function in the society. That's what, if we are able to provide
Right.
them with the right kind of support, they are able to function like normal people.
Absolutely, ma'am. Well said, ma'am.
Yeah.
So, ma'am, we all know that, as you just said, that when a child is growing up in his developmental age, the behavioral issues or the anger issues that is seen in the adulthood is probably the child had it in the the developmental phase, maybe in his young days, or when he was an adolescent, or when he was a child. So, ma'am, how do you deal with those children who are actually undergoing so many post-traumatic disorders? They see so much in their home or in their environment, and then when they come up to you, how do you actually deal with them?
Yeah, so it's actually difficult to identify the things which a child is going through, because their emotions are different, and the
Right.
way they react is also different as compared to adults. So we should know that if a child is withdrawn, or if he's not playing, or if he has issues with feedings, he
Right.
has got some anger outbursts. So maybe the child is going through some stress, and that stress can be related to any kind of abuse, or they have some trauma, or they are bereaving the death of a close family member or something. So during these times, if we are able to identify those signs, we should take them to the healthcare provider. And as a healthcare provider, we have to be sensitive, be patient, and give them time to open up with you. And as I said before, also they should feel safe to open up with you. And
Right.
also, depending on the condition of the child, we work with the interdisciplinary team,
Okay.
which is of psychologists, psychotherapists, behavioral
Okay.
therapists, and social services.
Okay.
So if we are able to provide them the right kind of support, they are able to handle it well.
Okay, ma'am. So, ma'am, it is said that, a healthy life, means a healthy planet. So, ma'am, how will you define this in terms of mental health? It has usually been said in the, of physical health, but in terms of mental health, how would you define this statement?
Yeah, so our diet and lifestyle, it puts a lot of pressure on the environmental resources, water, and biodiversity. So if we have a healthy kind of lifestyle, we are able to reduce that stress on the environment. At the same time, for adopting a healthy lifestyle, we need to have a good mental well-being, and
Right.
we need to have a positive outlook towards our planet, so that we can contribute to its sustainability.
Absolutely, ma'am. So, ma'am, as it is said that health is not just absence of sickness, but we tend to ignore it till we actually suffer from some ailment. And we only tend to focus on the physical part of it, not the mental part of it, the mental side of it. So, ma'am, how will you actually try and inculcate mental health in our overall consideration of our health?
Yes. So as you said, WHO has also given a definition of health. According to WHO, health is a state of complete physical, mental, and social well-being. So they have included mental and social well-being in the definition of the health already. So now it is the responsibility of society, of the government, to inculcate mental health programs in the health programs of the country, and also in different schools for the children and well-being, and not just schools, in working places, in colleges, everywhere the mental
Okay.
health programs should be inculcated. It is very important, because on this, it is our future is dependent on how
Right.
the world works. It depends on that.
Right, ma'am. So, ma'am, do you have any message for an audience who have, like, for people to on the mental health aspect?
Yeah, so we should take care of our mental well-being as much as we are taking care of our physical health, and stay happy, stay healthy, and stay safe. Thank you so much.
Thank you, ma'am. It was lovely having you with us, and so we will actually look forward having more sessions with you.
Thank you so much. Thank you for giving me this opportunity. Thank you so much. It was really nice talking to you.
Same here, ma'am. Same here. Thank you, ma'am.